A promising clinical trial to treat the intractable brain cancer glioblastoma. Doctors at the JFK Brain Center in Edison are deploying gene and immunotherapy along with standard radiation and chemo and finding they can virtually double patient survival rates. Brianna Vannozzi reports.
I never, ever expected to make it this far, and yet here I am 5 years later. That is a big blessing.
Donna Fabre is the success story doctors were hoping for. The wife and mother was one of the first patients to undergo a new clinical trial of a therapy to treat brain tumors. She was diagnosed with a malignant glioma in 2012. It carried a survival rate of just 14 months.
I really felt like I should do it because it came back, and it sounded like the best alternative that I had.
Surgery removed the tumor, but it came back less than a year later. That made her eligible for the phase 1 trial called TOCA 511 at JFK in Edison.
After people had the tumor recur or come back after they received standard of care, which typically included surgery, radiation, and chemo, they would undergo a surgical procedure again, and we would inject TOCA 511, which was a modified virus, into the surrounding tissue of the operative cavity.
Dr. Joe Landolfi is one of the authors on this study. This cutting-edge gene and immunotherapy uses a virus to infect the brain tumor cells while sparing normal brain cells. It implants a piece of DNA that makes a protein.
So that when the patient takes medication, it's converted to chemotherapy only in the tumor cells, thus killing the tumor cell. The virus itself doesn't kill the brain tumor cell, so once the brain tumor cell is killed by the chemotherapy, that virus can then go on and infect another dividing brain tumor cell.
Immunotherapy works by stimulating the body's own immune system to attack the tumor. Dr. Landolfi says the results mean huge possibilities.
For recurrent glioblastoma, as in the case of the patients who were on this trial, the survival was about 9 months, 32 to 36 weeks. So my patients who participated in the trial at the onset are now going on 30 months since the recurrent disease, 5 years since their initial diagnosis. So it's quite remarkable.
This works. This has given her quality of life. It hasn't robbed her of anything. If anything, it's just made our lives better.
My feeling is that a combination of our conventional treatments plus these immune or gene therapies are going to really change the face of the disease and the survival for the patients who suffer from the disease.
The success of this trial is a stepping stone for phases 2 and 3 and reaching the public.
In my mind, she's going to make 10 years. So I don't just look at tomorrow or next year. I look at the future, and I tell her we're going to be around.
I have to tell you, I never thought I would make it to 5 years. Never thought I would make it to 5 years, yet here I am. Very thankful, very thankful.
In Edison, I'm Brianna Vannozzi, NJTV News.